when a patient comes to emergency and he's a straightforward case, as you mentioned, a young guy, with no other associated comorbidities, what we should do in such patient? If there are comorbidities like CKD or hypertension or diabetes, what we should do?
Right at the outset, I want to state that 10% of the people can die in the first hour of the heart attack. And I think that time has come for everyone to know what they would do if a heart attack was to come. It is never a situation that heart attack will affect somebody else and not us. We have seen it in our daily lives with our close relatives, our friends. Just look around us. Somebody very close to us, or even in our family, or even amongst our friends, has already had a heart attack. It is perhaps the most existent disease process. So all of us should clearly have in mind, if I had a heart attack, which hospital I would go to, what I would do, where I want to go, and what would be expected thereafter. Because like you and I said, you cannot waste time. Otherwise you can actually die. First, our 10% of the people would die. And therefore, unless timely help comes in, that's what makes us survive. And that's what makes us live thereafter. So having thought through and gone to the nearest big hospital, there are two treatments after the diagnosis. And if it's confirmed that it's a heart attack, there are two treatment options. Clearly, the best treatment option, and there should be no ambiguity on my message to everybody who's listening, is open the artery by doing angioplasty. So what happens is, the patient is confirmed, taken straight to the cath lab, and angiography is performed at that very time with the least waste of time. The blocked artery is the cause of the heart attack, is opened up immediately, and a stent put in. This treatment is called primary angioplasty or stent implantation at the time of heart attack, is the most life-saving proven procedure in the world. Immediately the heart attack stops, immediately the blood flow is restored to the heart muscle, immediately we prevent the heart muscle from dying, and it alters the whole outcome of the patient, makes him safe and makes him better with less of a damage to the heart. Now, many hospitals, or at least now this primary angioplasty facilities, exist practically all around us. And we should be very clear well in beforehand where it exists, because it's better to go to that hospital where 24 hours such a procedure is being offered. The second aspect I would like to state is, many patients, when they are offered angioplasty, waste time. कि जी हम अपने चाचा से पूछते हैं, हम अपने किसी और को फोन करते हैं, हम अपने अंकल से पूछते हैं, अभी तो मैं फादर को फोन करना है, मेरे को तो कुछ हुआ ही नहीं है, मेरे को तो थोड़ी गैस ही बनी थी, मेरे को तो थोड़ी पसीना ही आया था, आप कह रहे हो कि अभी एंजियोप्लास्टी कर दो. Actually, that is what worries us as doctors. For every 5 minutes being wasted and every phone call being made, the patient is getting at a risk of a damage to the heart. And sometimes it hurts us that a 45-year-old or a 40-year-old comes in with a heart attack and continues to waste time, and his heart muscle gets damaged. So that's important. Now, there are some centers in smaller cities and smaller places, and many of the public hospitals, where straight away an angioplasty facility is not available. In such situations, it's also been clearly demonstrated that especially in the first 3 hours, the clot dissolving medication called thrombolytic therapy is a single injection or an injection by a drip given straight away will help to actually dissolve the clot in at least 50% of the patients, and sometimes in 60 to 70% of the patients if lucky. That can also stop a heart attack, but that's a treatment to be had if the facility of angioplasty was not available at that center itself. So that can be taken. But if one has the possibility, even at that center, to move to another center which is just close by, which can do an angioplasty within an hour and a half, then angioplasty is better. Having done that is actually what is the stabilization of the patient. So angioplasty as the first option and the best option, and the thrombolytic drug only as an option if immediate angioplasty is not available, and especially if you're in the first 3 hours of the heart attack. But point is, be very clear that this is the treatment. Don't think कि डॉक्टर तो आपको ऐसे ही कह रहा है या बेवकूफ बना रहा है या कुछ करना है या इसके बगैर काम चल सकता है. Heart attack is a killer. Accept what the doctor says, because practically in India, every doctor is practicing great medicine, and actually for a heart attack is very particular, more particular than the West even, to give you the best results and save your life straight away. And one of the things I wanted to emphasize was that you're right that the thrombolytic therapy, the clot dissolving drug, is not the end of the problem. It just sorts the problem out for that very time. And everybody should be ready after that to go to a center where angiography can be done, and angioplasty, if needed, can be done within the next 48 hours itself. Many don't understand this. Many think it's been a permanent treatment, and now why are they asking us to do an angiogram and an angioplasty? So I think it's a very important message that clot dissolving drugs allows us to buy time to stop the heart attack, so that we can actually go for a definitive treatment immediately after and have it treated for more permanently.